The topic of discussion in this video is the arches of the foot. In a previous video on the anatomy of the foot, we discussed the dorsum and sole of foot and briefly talked about how important the arches of foot are for normal body alignment and locomotion. Now we will discuss the arches of the foot detail. So, what are these arches? The arches of the foot are curved structures that run along the length of the foot, providing support, stability, and shock absorption during standing, walking, and running. These arches are composed of bones, ligaments, tendons, and that work together to distribute the weight of the body evenly across the foot. Now the second question is, how and why are the arches important in the structural anatomy of the foot? The foot must act as a pliable platform to support the body weight in the upright posture, as a lever to propel the body forwards in walking, running, or jumping. To meet these requirements, the human foot is designed in the form of elastic arches or springs. The segmented arches of a structure are designed to effectively withstand the pressures of both weight and thrust. As a result of the arches, the sole of the structure becomes concave in shape. This concavity can be observed most clearly by examining footprints, which reveal the parts of the sole that bear weight. These parts highlighted here, heel, balls of big and little toes, are the part of sole that bear the weight of the body. Overall, the arches of the foot are important for maintaining proper foot alignment and preventing injuries and conditions, such as plantar fasciitis, flat feet, and stress fractures. We will talk about them later. But first, our focus will be on analyzing the structure of the foot's arches, which includes the bones, ligaments, and tendons that provide support. So, stay tuned.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.